So I decided to play around with the age filter because I wanted to see if it was going to be a true representation of how Black people age. And I just want to make sure everybody knows that obviously there is a variation in how all Black people age, but generally we don't age as fast as Caucasian patients and we don't age as extreme. And so let's talk a little bit about this. So in this filter, it shows, if you look closer, it shows some fine lines and wrinkles on the forehead, which for a lot of patients, at least in my experience, I usually start to see very minimally in the 30s, but more in the late 40s to 50s. So that's usually when people come in for like Botox. Overall, you can see that my skin is more pigmented. So that is the major way that Black people show their age, is with pigmentation, which is why having a nice even skin tone is important. Obviously using sunscreen to prevent UV damage and photo aging. And if you have a nice clear skin, then nobody really pays attention to the volume loss, right? Because your skin looks, very nice and clear. The next area that I noticed is the eye area. So that's very important. We usually would have in around the 30s, you would start to get like teardrop deformity or sunken under eye area. As you get older, the fat underneath the eye can protrude, so you start to get these bags. So that's from fat protrusion out. And then the nasolabial folds are very prominent, but the reason why they're so prominent is because you have lateral and mid-face volume loss. And so when I do this type of lift, you see that the nasolabial fold improves significantly. Also, you'll notice this line, we call it the nasojugal groove. That is very prominent in Black patients. And so improving the mid-face will get rid of that. It will also improve the teardrop deformity and give you a lift, so you don't need to put so much filler in the nasolabial folds. And then lastly, the jawline, it doesn't really look like it's changed much for me, but for some people, they get really heavy here. And so if you've lifted up in the first third and the second third, and then the last part, if you still need to do something, you can then maybe do a little bit of chin filler to elongate the jawline. So overall, I would say this is probably not the best representation of how the average Black person ages, but nonetheless, you still have to wear sunscreen so that you can keep your skin looking smooth and clear, because if you do that, then no one's really going to care too much about the volume loss. And then if you want to do something, you can do Botox for little wrinkles, you can do fillers for mid-face volume or nasolabial folds. Make sure you're eating really well, especially take your vitamin D, please.